Now we need to talk about the 4 ethical principles. These are autonomy, beneficence, non-maleficence, and justice. The autonomy is when the patient, that is the right of the patient to decide what's going to be done to the body of the patient, or whatever, is to take the decisions by their own decisions, and the physician should listen what the patient wants, and so the physician needs to do what the patient is saying to do. This is autonomy. Beneficence is that the physician promotes the benefit, that is, that the physician does what is better for the patient, but sometimes beneficence and autonomy can be in conflict, because maybe the patient wants to not undergo the treatment, but the right thing, or the thing that is going to work best for the patient, is to go into the treatment. So in that case, the physician is fighting against autonomy and beneficence, but overall the autonomy goes first. There are few exceptions in which, if let's say the patient do not want to take the treatment for tuberculosis, the physician should, even though that, give the treatment for tuberculosis because of the risk of infecting other people. So in that cases, or other reportable diseases that are, for example, HIV or other sexually transmitted diseases, or Ebola, for example, the autonomy could be over rights, and also the confidentiality. And by the way, the wards are not reportable diseases. They are not infection that not potential infection that needs to be a broken of confidentiality or of autonomy of respecting what the patient wants. In beneficence, we have like 4 rules for beneficence. These are: promote beneficence, the benefit of the patient. Do not, well, you could see beneficence and non-maleficence as kind of the same. The non-maleficence is never harm, and this is like the theory of Hippocrates, that is primum non nocere, that is first not do harm. This is do not harm. Also is, if the patient is harmed, then remove the harm, and prevent the harm. So in primum non nocere, this Latin expression is just first do not harm, even though when in a strictly sense, when we are performing, for example, surgery, the first thing that we do is to damage the patient. When we are cutting the skin or something like that, we are damaging the patient. But we know of what we're talking, that the result be more benefit than the adverse effect or the other things. Justice is just that every patient should have the same attention, the same places, etc. But this is difficult to accomplish in any kind of setting. Now, just with respect to beneficence, there is something called the good. The good Samaritan law. This is when the physician, consists of four major aspects. Is, let's suppose that the physician is in the car that is outside the hospital, so outside of he or she or her obligations. So it's outside the hospital and is let's say 9 p.m. after the working hours in the hospital, and is in the car and sees that a person enter in cardiopulmonary arrest, or is having a car accident, or something is happening to a person. So the physician has two options: or go to try to save the patient, or to try to save the person, or stay there and continue wherever. It is not the obligation of the physician to try to save that person, because it's outside of the hospital, and also even is in the working hours of the physician. So it is not obligation of the physician to get down of the car and try to help that person. Now, if the physician decides to try to help the person, now we have 4 things. First is the physician should act within the physician's competence. That is, yes, if the physician has like a or if the physician can do CPR, for example, the physician, that is, if the circumstances are good, the physician can perform it, so go ahead and the physician will do it. But if, let's say that would take a long time or something like that, it's better the physician to call to 911 in order to get help or emergency help. That is better than just trying to be heroic in some way, of having to try to be the one that save the patient. No, better call 911 and try to assist the patient in whatever the physician can do. So that the physician acts within the physician competence. Next, that the procedures that are going to be performed are only allowed or approved procedures. This is, the physician can only do, for example, CPR, the cardiopulmonary resuscitation. But if there is a new way of do that, or a experiment way that is being conducted, no, or is something that is not approved, the physician cannot perform that. Just only can perform what is approved. The allowed procedures are the only approved procedures. Next is the physician should stay with the patient, or with the person, or at the scene, until the paramedics arrive and the paramedics realize that it's a controllable situation for them. The better or the ideal case would be that after the paramedics arrive, also the physician goes into the ambulance and try of helping in some way. But at least the physician should go until the paramedics arrive, or when the paramedics arrive, and be comfortable that they have everything under control. And the last one is no changing hands. This states for no receiving money or gifts from the person. That is, the person maybe wants to give the money or a gift to the physician for having stopped the car and help the patient, but the physician should not accept the money. One, because it's like non-noble thing. The physician is doing that because that's what the physician wanted to do. The physician wanted to try to save the patient, and also could be misinterpretations and they could think that the physician does that only for having money or things along that line. So we would talk about this in a little bit, changing the concept, the circumstances, but with the same subjacent concept. And the other issue is that if the physician accepts the money, in that moment the person now becomes the patient of the physician, because now was performed a physician-patient relationship in which the physician attends to a patient and then the patient pays the physician. So if the physician accepts the money, now that person is the patient of the physician, and now the physician should take care of that patient. So in the good Samartian law, the physician is not obligated to stop the care to do extra hospital activities, but if he or she does, then first, just act within the physician's competence. Second, just perform treatments or procedures that are approved. 3. Remain with the patient until the paramedics arrive. 4. Do not accept money or any gift.